So my presentation is about the most marginalized, the so-called slum dwellers, and especially the slum dwelling women, the marginalized women's everyday efforts in ensuring health and well-being in their, of their families and their communities. And that is in relation to housing infrastructure required for communities' health and well-being. So here I will also occasionally use the particular extreme case of COVID time caring because that is when everything was tested to its limits. So I'll bring some. I will talk about a general scenario and then some examples from that time to make it really meaningful, the lack of infrastructure and how that affected caring. So that will be one of the strategies, and I will be using examples from Bangladesh, and especially a small climate vulnerable coastal town that's called Khulna. And this is part of an ongoing research. So I'm just presenting a very sketchy version of what we know so far. So you may look at it, at best as a story. So the session plan, it includes, I will be first describe the health infrastructure scenario in Bangladesh, in the informal settlements of Bangladesh in general. Then I'll discuss the approaches and introduce you to the site. Three sites actually, not one site. So three sites where I am doing this, conducting this research right now. Then I'll be discussing about healthcare infrastructure situation in those settlements, and sort of trying to identify some scarcities and inequalities prevailing in those settlements. The roles of women in there, the community in terms of the women's role there, and try to relate to some extent to a very sketchy way to relate equity with care. So why focus on women? Because women in the informal settlements, through this, through projects like this, for the last, I would say, 30 years or more, they have been engaged in various microcredit activities. You must be aware of Dr. Mohammad Yunus, the banker for the poor, who involved this women in microcredit schemes many years back. And then in many other forms, these women started becoming involved in the improvement of millions of urban poor's quality of life, their empowerment and leadership through numerous community-based organizations. And they're also involved in communities' need and priority assessment, creation of funds for credit and infrastructure development. They are involved in participatory, need-based, and efficient planning, design, and construction of essential infrastructure in the settlements. The scaled up. These ideas are scaled up. These in some cities, including Khulna, these became citywide movements, and their active involvement in political and social network. So in general, women have been, you could tell very easily that women have been the very engines of development in these settlements, where about 1/3 of the city population lives in not in Khulna. It's sort of the general scenario in the world. So that includes a lot of people. So we will be using Professor Caroline Moser's, the famous social scientist framework on women's triple role in caring for their families and communities. And these three roles includes reproductive role, which is the household role, the productive role, which is the economic role, and the community role, which is the works done for the betterment of the communities. These are, of course, unpaid and often volunteering roles, and which they do in their free times. So, and that is where Bangladesh is a very small country. It's very almost difficult to find it on the map. So I tried to identify Bangladesh there, and Khulna is even a smaller, very linear size city. It's left on your screen. And if you look closely, you will find a lot of small dots, This is a map produced in 2010s by UNDP. These are location of the informal, so-called informal settlements or slums, you may call it. So they are sort of distributed all across the city very evenly. This is sort of a City, a city, is a small city in terms of Bangladeshi population is about 1 million population we have in that city. But then again, about 30% of the total urban population are so-called slum dwellers in this city, and they contribute quite a lot to the GDP. So that is why they're planning their future is very important, and that makes it worthy of any research and any intervention. So if you look at this the scenario, the general scenario in Bangladesh, it's quite interesting. This is the healthcare, health infrastructure scenario. If you look at there, you see the government people basically do not trust the public hospitals because they think they won't get treated very well there, although it is sort of free. But then again, they don't do it. So you can see that about 61% of the population they go to pharmacies and quacks for their treatment. The water scenario is better compared to some of the African nations because they suffer a lot. Water scenario has improved in general in Bangladesh. So about half of the population they collect water from standpipes, deep tube wells, supply water. So that makes almost 100%. So that's a better scenario. The nature of toilet is still, I would say, still a bit tentative. The sanitary latrine usage is people about 50% people they use it, but the share in this informal settlements, they share a lot. They share these toilets, the bathing areas, and everything. And the waste management scenario is also, I think, is quite a mess. So it's not very good in these settlements. So from our this is an outcome from a research we have already conducted. So you can see these three. Uh, we try to focus on the infrastructure there. So we can see the very poor scores in terms of house size, space availability in those houses, ventilation, in terms of lighting, shower wash facilities, and solid waste management. So the scoring was not that good. This is the general scenario from Khulna. So, and of course, this has implications for the SDGs, and especially in these aspects, because we are talking about health and health equity. So it concerns the hunger, the food product, the food security issue. Then this inequality. There's also issues about clean water and sanitations. And for sustainable cities and communities, which is SDG 11, these are all sort of very related when we talk about equity in this in health infrastructure. And concerns have been widespread. This is a American Journal of American Medical Association publication from 2019, where they are still concerned. They are talking about Bangladeshi slums, and they are showing their concern that in urban slum health must become a global health priority in the 21st century to avoid a humanitarian crisis. So this is something very, I would say, very timely. This topic, this session, and this discussion, this class is very important. So we received similar feedbacks from our last presentation when we did with epidemic urbanism. So we sort of asked a few colleagues from, we had responses from 15 participants from 15 nations, that including Bangladesh, India, Uganda, Nigeria, and Zimbabwe. So some issues that relates to health directly or indirectly, they were raised at that particular presentation as well. So this brings us to our question. So how do people with this, all these scarcities and inequalities, how do people survive and thrive there? And could material scarcities be compensated with materiality only? And is there any specific relation between equity and care? So this made us, pursue three objectives. So first will be, I'll be reporting on the infrastructural scarcities and inequalities that are present in those settlements that affects women's caregiving. And then we'll see what women do about it. How do they tackle, how do they manage through these, scarcities and inequalities? And then we'll try to argue whether women's caregiving improve equity toward urban poor's overall well-being. So these are the three settlements we are talking about. These are like, the scales are given there. They're like, very high density settlements. So the first one, this one, this one is a jute mill housing that turned into a private jute mill house, turned into a slums. People started encroaching it, and the threshold, actually they have crossed the threshold many years ago. The second one is this one is the railways, Bangladesh Railways land, again illegally encroached. And then this one is a site and service, more planned settlement that has turned into a so-called slum, without these services and everything. So these three will be our subject of investigation. I mean, from here, we'll be drawing our findings from. So coming from the scenario, if you look at the the complex scarcities in terms of spatial and physical dimension, I mean, there are certain things we are already familiar. I'll just read through a few of them. Maybe we'll discuss it later. So it's I mean, in all the settlements we can see small houses. Often 5 to 8 people living in a single room that has a size of 10 to 45 meters square. These are kacha houses, means non-permanent houses. There is no vertical extension opportunity. There's most often there are no windows. You can see this room. There is no window of this building or room. No veranda to convert into a room. No setback space to extend to. No attached toilet. No public space except for the streets. And inadequate absent community infrastructure, like clinics and everything. This is quite interesting. I mean, if you look at the roofs of these buildings, these are from not from these three, from another few. You can look at the roofs. They're all non-permanent roofs. They're not built with RCCs and everything. So that restricts you to go vertical. There you can, of course, you can say that there is a 2-story building over here, but this is sort of a 1.5-story with some mezzanine floors in between, built with wood. But the norm is whenever you are encroaching a public land and building there, you cannot build anything permanent. You can go about building permanent walls, but not the roofs. So that makes you, that's a symbol that's that, and it is where you stop, and you cannot extend anywhere. So even if your families grow. So that's quite an interesting thing they sort of maintain, and it's sort of maintained all across the settlements. There are scarcities beyond beyond the physical and spatial. There are issues of illegal and informal tenure that we just saw, because most people, they are just encroachers, so-called encroachers. So their tenure, the level of tenure, it's not secured, and it's not legal in the formal term. So sometimes these settlements and their decisions are politicized. It's possible because they're all the vote banks of the the people in power. So they provide cast vote for someone who is in power. They can, and the relation is sort of both way. But this politicization often affects the service delivery from the government side. For example, and it creates a sense of discrimination for some with less power. Poor are among them. So it becomes a problem. There is also coordinated infrastructure, lack of uncoordinated infrastructure construction by NGOs, like same building, same sort of projects done by 3-4 NGOs, and there is no coordination. There's lack of knowledge and skills, and there is absence of any design standards, lack of trust in public institutions. In economic terms, these people are mostly informal and daily job holders. They lack savings. They cannot access credit because they don't have a permanent address. So the banks do not give you credit. They only receive credit from the NGOs, and that is in very small amounts. And there is also problems with food production and security, food security, and there is not much from their end. It's almost impossible to invest in infrastructure that helps create an equity. So these are the sort of the perception surveys we have carried out. I'm not going to details. So the things we have seen there, we collected through FGDs and open-ended questionnaires and interviews. The perception survey also sort of comply to that. So coming back to the role of the triple roles of women, the first role is the reproductive or managerial women. It is sort of this include the childbearing role, domestic chores, attending the sick and the elderly, everything that is typical. And normally these guys, they live together because these are all extended families from a family of 5 to 8. 5 to 8 means, I mean, the husband, wife, two or one child, and then the parents of the husband. So they live together in a single room, like that. And the restricted house extension affect coping with growing family needs and emergencies, and of course, home-based works, because there is not much space available in the buildings, despite they have the skills to do that. And there is also lack of. It also leads to mental. I mean, it affects mental health, affects sense of privacy. The storage capacity becomes low. They cannot, when their food is cheap, you cannot, buy and hoard it for a long time. And uh, and it also affects, the provisioning of attached the bath or toilet. Ventilation airflow is also severely compromised. That often leads to respiratory diseases. So this is the middle portion is the some of the homework scenarios. This is the drainage scenario, and this is the typical size of the house. You can see the single house over here and surrounded by very narrow streets. And then so it's quite interesting, how the size and how where they do all sort of I mean they sort of carry out the household stuff, maintain privacy. This quite critical. The productive role is the economic omen. This is, I would say, omen where they provide direct labor and producer of, I mean, they also produce livelihood resources, like livestock and poultry, and they go either into microcredit, small enterprises, and many home-based works. And these often they are the sole breadwinners. Sometimes they are in support to the main breadwinners, but somehow, I mean, they are, I mean, they work, they have to work. And the best thing, I mean, I would say best, or the most important thing they do is the management of scarce livelihood resources, because they have to manage resources. And the shocking is sometimes, in COVID time, we have seen examples when women stopped having enough food because they don't have food, so then stop intaking, or curtailing, often starving, and then they fed this to their children, the male members, to keep them healthy, and sort of compromising their own health. They also purchase stuff on credit using good social capital or social reputation. So this is the third role where the women really thrive, and that is where I'm going to focus, because this also relates to our theme of our presentation here. This third role is the community manager woman. So this is in our study we have found women engaged in as many as 6-7 roles at a single time. So they're engaged in, they get themselves engaged in 5, 6, 7 organizations to get, I mean, at the same time, because they try to be involved with as many as they can. That gives them certain sort of mental buffer, although they are not paid. These are not really paid jobs. From these 6, maybe they are paid from 1, very scant amount, it's not much, but then they still get themselves. But what they get out of this, what they do actually, then we'll talk about what they get out of. So what they do, they coordinate between NGOs and community. They manage funds. They supervise trainings and construction works, community mobilization. They sometimes they go door to door. I mean, make door to door visits, arrange courtyard meetings, and provide occasional labor. In COVID time, we have seen they source aid. They found look for philanthropists or donors. They listed beneficiaries, managed aid, assisted the poorer among them, and identified the hesitant who are really fearing the loss of dignity if they're if they thought if we take aid, accept aid, then we'll lose our dignity. So they sort of identified those. They carried food in their own hand, and then I mean, transported it to their house to sort of save them. These women also, during the COVID, they planned special locations for aid distribution. They marked isolation circles, identified checkpoints, areas for installing hand wash basins. They also set rules for using community spaces and hand wash facilities. So these are pretty interesting things. There are certain principles they set, and based on those, they manage the incoming and outgoing of people during that very hard time, very difficult time. And they created pool for aid distribution, and when the aid flow dried up, some used their social network to reach wealthy patrons and convince them to donate aid. These are some photos from that time. So what they were doing during that time. So and the same perception survey here. Okay. So so sort of so if we summarize, you can see that if we summarize, these three are three different roles. So you can see the spider web, and you can see the scoring. The bigger the red, the marks are, the higher the score of that particular aspect. So in here you can see that the reproductive care or the productive care, the role in that those two, they scored poor. But when you look at this woman community caring role, you see it scores much higher than the earlier two. And putting them together here, you can see it scores much higher than the productive and reproductive care. So that is what makes us really interested in is there anything in that role that helped them cope better, whether that role is what, because we asked a question whether that helped them survive in the first place. So then we try to understand what is equity. So we just we're not defining it. These are the two definitions we took from two US government websites. uh, so the key thing is equity is fair and just opportunity for all, uh, and access to care and health outcomes. This is a health equity means. And equity is based on ongoing societal effects. This is very important. The efforts of the society or the community, that is what creates equity. Not only architecture itself cannot create equity on its own. In that case, it's the social gene, the social thing that works underneath, that creates equity. And it has to ensure that the fair and just opportunities are created for all, and they can access to care and healthcare outcomes. These are very important things. And caring also is quite interesting. We took, uh, definitions from other sources, credible sources, of course. We saw that caring also involves human activities and connectivity. Infrastructure involves policies, resources, and services that support health, happiness, and societal bonds. Uh, that is to help us continue, maintain, and repair our daily activities to live longer and happier. So together they make sort of common sense. So when we put them together in here, you can see. So community, we saw that community role, since it is still in progress, we still do not know. I already confess that is in the sketch here, very early stage of research. But this is sort of the hypothesis, a framework we are working on. Whether that community role, whether that is has any influence on the productive and reproductive role, and we try to write down a few points. For example, uh, it can help. The community role can help uh, perform the productive and reproductive role better. That, for example, I'll give one example. If the community role is bottom is networking, support, coordinate to NGOs, networking with external connections, that will bring you external resources. Through that connections and networking, you bring in resources which you can use to improve your house, improve your neighborhood, install new infrastructure, and then the improvement of the overall settlement. So it's sort of a relation with a good community role, good community leadership. You can bring in what you do not have. You can fill in the gaps, fill in the missing chunks using the external relation. That is quite interesting. Sort of women's, in that case, women's three roles, especially the community role. Uh, of course, that benefit. We believe that benefit both reproductive and productive roles. That can be viewed as a continuous caring effort, reduce inequality, and of course scarcities. How? By improving opportunity and availability, access to resources and infrastructure. That will help improve equity. And if we sort of try to establish a sort of even sketchy relation, and we talk about the approaches for creating healthy communities. I mean, equity care relation, we can try to explore that. Equity can be a product of three-level care by the community, especially the women, where it is possible. In creating healthy communities for the marginalized, care can be a useful lens. A care infrastructure that includes policies, actions, resources, services are essential for ensuring equity and well-being. And architecture here is not a mere building in this context. Instead, instead of architecture of the building, it should be viewed as an architecture of the settlement. So the unit of analysis changes. If you think it's not a me settlement, it's of a us settlement. So the scale, the unit changes. That helps you, sustain better. And it is more, and often it is more about managing what you have instead of building the new infrastructure. But that is what we saw in COVID time, because I didn't give the exact examples, but I can discuss in the QA session if needed. And architecture to act like a stage or backdrop. So the role of architecture can be a bit different. Sometimes it's the direct role. Sometimes it can be a backdrop, or a staging role that architecture can play in here. Uh, so going back to this, issue of uh, sustainable uh, sustainable development goals. So to warrant a sustainable settlement and well-being, maintaining, continuing, and repairing our world, which is actually caring, would require our social environment. Uh, it needs to be accommodative, enabling, and empowering enough. And alongside this, our physical infrastructure, they should be intertwined. They should be, work as a whole, the soft and the hard. I think that's sort of, ends my session. Thank you.
Thank you so much, Professor Hakim, for your very interesting presentation. Could you tell us a little bit more about where your research is taking you and what the project components are now that the COVID period is less of a concern for these communities?
All right. Basically, health was, it was not our primary focus, but we are trying to look at the community processes, the role of women in it. That was our basically, the basic interest. We collected all the information because the community women, they were already involved in this. They have been involved in these sort of projects for last, say, starting from 2008, it's about 15 years. They have been doing that in using with their own hands. So we're trying to see, how they responded, because we know they had, scarcities, they had these inequalities, and everything was there. But how they, even in a situation like the pandemic, which was even worse than the the ongoing situation, it made it even worse. How did they, survive? That was our main question. That was uh, we were really looking. I have two of my other co-authors, so we were looking forward to that. We were looking to investigate that. And then we also try to understand the perception of the women, how they perceived. So then there are two parts of this, analysis. First part, we actually asked them. And second part, we sort of, allowed them to, convey or communicate what is their perception. We used, different participatory maps and everything, participatory other tools, and try to, that create that sort of graphics we just, shared with you. So it is, and with this health issue coming up, that makes it quite interesting, because it was Mohammed's call to, really telling me that you focus on, see that where equity, whether that is creating an equity or anything, because they are doing it, naturally they are doing it, they're building all these drains, installing toilets, installing, tube balls and everything. They're doing everything for, as I was saying, like for the last 1.5 decades. But then it sort of, helped me change my perspective a bit, because to face you and to, present you this, this equity issue. So maybe I will just change my focus a bit, and maybe I don't know whether I should work toward a new project to keeping a health equity at the center of everything. So that is my benefit from appearing before this forum. That is that my personal benefit. That is actually what made me interested. First, I said no, I cannot. Then I really thought it's quite interesting because I have all the understanding of that thing. Sort of I have to collect some new, maybe some more specific data. But this is what actually I had. That is why what I presented before you.
And just a little bit more specifically, I'm interested in um, whether the tendency is to want to support these women and to help them to manage their own communities and their own infrastructure, or if it is to somehow, not you personally, but somehow to take over from what they have already implemented.
No, just a person on a personal note. Uh, this woman, because we have been, because I did my PhD in 2012 on similar issues, because I have this, sort of a personal connection with this interest with this topic of informal settlements, their special politics and everything. So I know them for like 12 years myself as well, many of them. So from there, I have another, because I did my master from IHS from Netherlands. They are a school, they are sort of, interested in housing, urban Institute of Housing Studies. They are into housing of every sort there. We are sort of creating a team and trying to actually support building a women's federation in the citywide federation, because they are in the process of uh, building one. They're struggling for some ideas, some support, that's sort of external support, some monetary support. We're trying to looking for some funds as well to help them establish, because these forums already they exist in India, places like India. They're very big in India. In Thailand, places like Thailand, they're very big. In Pakistan, they're very big. But in Bangladesh, they are sort of on the, I would say, in the initial stages of germination, things like that. So that is why we are trying to be the support, or whatever way you put it, but just to be there beside them, and actually follow what they do, and maybe lend a hand if they ask for it. Otherwise, they understand their thing very well. So we are very gentle into this thing, not really imposing ourselves on the things. In that case, it will not remain participatory anyways.
Perhaps we can look a little bit more at the context of gender and ask why the women are needing to take on this responsibility as a group. Why does not the whole community living in these informal settlements wish to participate in developing the infrastructure?
Yeah, this I have to answer from a, I'd say, from a sort of a historical perspective in Bangladesh, beginning with Dr. Yunus, the Nobel laureate's experiments, when they began, lending this little amount of money to these groups. So historically, the Bangladeshi women, they are historically or genetically, they are more responsible. Uh, they are more responsible in handling and handling, money and managing. I raised one point. You remember, I said that they are managers of scarce household resources, because they have to manage through. They are the guy, women who have to, ensure that even if your man is not working, you have to ensure that food is there on the table for your kids and everything. So they are historically, they are sort of a good manager of scarce resources. So Dr. Yunus started, when he started lending money, and he thought that if we lend money to this women, because they are different from this men, because men, if they borrow, they will maybe just go and purchase a few kilos of beef, and they will just eat it up. But women, they will actually make use of it, and they are good borrowers, because once she borrows and if she commits, she will return it like in 1 month. She will return it. And then if that doesn't happen, then he created a sort of a social group that can actually look after each other. So a group borrowing. So if there is a group of 8, I lend money to 2 of them. Other 6 will look at her and make sure that she is well supported, and she is returning the money in time. So that was a good experiment to begin with, and it's in the mind of this woman. So this has been sort of has become a sort of a very interesting approach to microcredit. So then this project, the one I was showing, the UPPR by UNDP, here they involved this woman through a small partnership, because that was this called UPPR, means urban poverty reduction through partnership. So small partnership to improve their settlements. So 90% was of the money was coming from UNDP and 10% from the community, which they saved, among themselves. So that thing that started 30 years back, the same thing, all actually were used by the same women, the women, in the same way to improve their community. And this was, and the men, they tried to resist first, because this is a Muslim majority country. So it's not very, I would say it was not very easy in the first time. Initially it was not very easy because it was not accepted by the men, that women will, they are taking lead, they are borrowing, and they are doing their own thing. They are becoming the sort of the de facto family head or a decision maker. But in time, this have been socially accepted as well. So women, that is why they, for example, if there is a group of 10 women forming a CBO, 10 people, then only one can be male, and then another 9 should be actually female. That is how these ratio have been in this, and they work really well. Because the men, they married, they sort of, they leave their families behind. They have their own, own world. They're sort of extrovert. So that is why they focused on this female, and this actually worked in favor of, whatever good that happened. So that is where, things began. So it's a bit, in the construction of the, I would say, the mind of this woman, sort of the cultural thing that had happened, then experiences that took place earlier. So together they sort of, work well, and still working well. That's I think that sort of, answers what you asked for. Whenever there is a resource, for example, say there are 10 NGOs working somewhere, and one NGO is giving you, say, one tube oil to install somewhere, right? So that is a tangible resource. But with networking, because you have a good networking, you can involve the other parties who will use a water filter to filter that water. So you are bringing tangible resources, and then you're networking as well to make sure that water is even better than the first place. So that is a very, I would say, very crude way, but this is a very simple way how you engage both sorts of resources. So resources are, they do not necessarily have to be tangible resources. These relations, right? This networking, social networking, this connection, this know-how, this power to pursue politicians, power to pursue and reach the politicians, reach the organizational heads. These are actually very important resources, I think. And the most important resources among them is the power to create a community out of nowhere, right? Because these women, they are sort of, they are coming from different places, right? Different places. And then together, when they are sharing a very tight, very dense settlement, the same site, and then they are among themselves, they know what the common goal is. So to achieve that goal, you're organizing yourself, right? And becoming a community, even if it is makeshift, but still it's working as a community. So that, and there is also some mutual trust. Of course, there are problems. It's not that, very, I would say, very sugary, it's not really like that. But of course, it worked. This sense of community, and we don't have this sense of community even in our middle class neighborhoods. Forget about the rich neighborhoods. The only sense of community, I was discussing this in an workshop 2 weeks back. So it was an USAID workshop on resilient cities. So they were discussing some projects, potential projects. I was telling them that I think we should learn from the informal settlements how a community can be created, and then we can replicate that, use that idea in the middle class and higher middle class, settlements as well, because we are focusing so much on them. They are doing very well there, but we are not really using that knowledge to create, the sense of community in other places as well. So that I think, yeah, gives you some idea. Yeah, the resources, I'd say. Yeah.
Hernan, you have a question.
Yeah, my question was, Did you come across any instances where some of the spaces that women were using started to become more permanent and formal? For example, as there were examples where women were leading workshops outside and when we were teaching inside. I just wonder if those ever translated to any like actual physical um, like manifestations of spaces that then became adopted by that community and maybe led to some sort of like empowerment even within the home or in a more public setting.
Yeah, like, since we are all architecture students, I mean, including myself, we are always interested in permanence, right? Yeah, of course, there are settlements where there is a process of consolidation, right? Because the consolidation process is ongoing in certain settlements. I was showing you, remember the triangular site, the triangular plant site I was showing in the first place? That one is, I would say, experience this phenomena quite fast. And especially they have, because this was a planned settlement, they had spaces for communities, some mosques, some schools, some, community level infrastructure. And I think the photograph is from there. It's called Bastuhara. So yes, in those places, they are trying to consolidating. I mean, they're trying to make permanent marks of their own, because they had a tussle with the government bodies who gave sort of, sort of, they had a de facto sort of, tenure sometimes back. So the negotiation is almost at the last stage right now. So now, once it will be, in their favor, it will come to their favor. So knowing that, they already have started building all these, permanent infrastructure, at least at the community level. And there are also some houses. They also build some houses with, permanent roofs in those, but not the other two, because the other two are really encroached, and their ownership is quite complex. So it's not, it's not very easy to those to become permanent. But this one, is because this is one of the first generation, the site and services housing provided by the government in the late 1970s. So it is almost 50 years old. So it took them about 50 years to really, uh, build and go for some permanent structure. About 50 years of, struggle and something like that. Yeah, but that's a good question, I would say. Yeah.
Thank you, Hernan, and thank you for your thorough answer, Dr. Hakim. There's lots of things for us to think about in terms of community involvement in the development process and how valuable that is, especially in terms of health equity and equity of in all categories, making sure that different perspectives are taken into consideration. And as you mentioned, that there's a kind of negotiation process where people come together to talk through the problems, and experts weigh in and the community weighs in, and they come to hopefully some sort of consensus together. Okay, well, thank you so much for joining us today. That was really insightful, and I look forward to hearing more about your research in the future as you continue to work with the community and follow their progress and their decisions.